Right, so we're going straight up to resolving your care plan. And like I said, when we help you in getting the best of your care plan is you must have um, fundamental knowledge about these three core subjects, which are anatomy and physiology, medical surgical nursing, and pharmacology. And why do I say this? It's because when it comes to your nursing diagnosis, you need the knowledge of anatomy and physiology and also med surg to know what is going on with the patient because your nursing diagnosis can be deducted from your pathophysiology, which is the signs and symptoms. Remember, how we can get our nursing diagnosis is from the data collected, and the data could be from the primary source, which is from the patient directly, or from the secondary source. And if it is from the patient can be telling you how they feel. Then if it's secondary, it's from probably lab result or from the patient relative. So let me give us an example because this care plan here is that of a respiratory disorder, which is of a patient having asthma. Now, if someone is having asthma, the patient will give you complaints, right? Will complain of breathlessness, will complain of dyspnea, will complain of tightness of the chest, and also there will be laboratory results. So we will know the the disease process that is going on there. So when it comes to asthma, asthma is the hypersensitivity of the lungs to irritants. And what happens in asthma is two special cells or some structures are hyperstimulated. The mast cells are stimulated, and when the mast cells are stimulated, there's release of certain chemicals such as histamine, bradykinin, and prostaglandin. These chemicals that are released, what they do is they um, act on the airway, causing bronchospasm or constriction of the airway. And then the goblet cells are stimulated to secrete mucus, and there's excessive secretion of mucus. So there is tightness of the airway or bronchospasm, and there is release of mucus. These two processes together causes restricted flow of air. There is restriction of airflow, and because there is this restriction of possible respiration, and then you hear that sound of wheezing, which refers to that wheezing respiration. So we see the reason why there is respiratory distress. And the process, because of the respiratory distress, the patient will be very anxious, and then there will be anxiety. So I'm going to be resolving two nursing diagnoses. So the first nursing diagnosis here is ineffective breathing pattern. And why is there ineffective breathing pattern? It is related to bronchospasm and exudates in the airway. And this is evidenced by wheezing respiration, cyanotic lips, and cold extremities. It's an objective. The patient will breathe with ease. That is 16 to 20 count per minute within 30 minutes of nursing intervention. Now, when it comes to your objective, it should actually be realistic. This patient is having respiratory difficulty. We cannot put 4 hours or 6 hours because someone cannot be deprived of oxygen for 6 hours straight. Your prognosis will turn out bad. So what we do is we use a specific time range. Just like someone is having running temperature, within an hour it should be resolved. So here is 30 minutes, right? So what are the nursing interventions? Number one, you assess patients' vital sign with emphasis on respiratory rate and also on oxygen saturation. And why are you doing this? Is to obtain baseline data. And also you can also do this intermittently, which is checking the vital signs intermittently and is to monitor the progress of management. Then number two is you nurse the patient in a well ventilated environment, and this ensures adequate oxygenation. Number three, remove tight clothing from patient's neck, chest, and waist, and this facilitates breathing and promotes patient's comfort. Then number four, You put the patient in Fowler's position. This positioning helps to facilitate breathing, makes the patient breathe with ease. And 5 is if you're asked to administer oxygen, you administer it if it's prescribed. And the reason is it helps to improve tissue perfusion. Now, when we're resolving our nursing care plan, we used here in this particular diagnosis, we used 5 nursing intervention. When you are resolving in an exam condition, the list should be 4. But if you have more than 4, you can add to it. Now, after you are done resolving it, which is after your nursing intervention, the next thing you're going to do is you will nurse the patient. After you are done nursing the patient, you're not scientific intervention. The patient you have nursed, you will evaluate the patient and you check if your care given was able to resolve the problem. When it comes to evaluation, our evaluation is to check if our goals were met, right? And our goal was that within 30 minutes of nursing intervention, the patient will breathe with ease. Now, what happens there? In our evaluation, it says the patient breathed with ease after 25 minutes of nursing intervention. And what I did is the timing should be within the 30 minutes, not outside. If I say that the patient breathed with ease after 30 minutes of nursing intervention, I am wrong. It should be within the time, not outside the time. So our nursing care plan has to do with your date, your serial number, your nursing diagnosis, your nursing objective, your nursing intervention, alongside the scientific rationale, and then your evaluation. So as we go further in resolving more care plan, it will be much more easier. So let's go to the second nursing diagnosis. Anxiety related to unknown prognosis of disease condition, evidenced by patient asking questions frequently. One of the key signs to see if someone is very anxious is that the person will be asking questions, especially unnecessary questions. So, what is our objective? Our objective is that the patient will show no sign of anxiety within 24 hours of nursing intervention. The first thing we do is we establish rapport with the patient. And what does it do? It promotes cooperation. And secondly, we explain the nature of the illness of the patient, which includes the procedure and the prognosis. The prognosis means the outcome of the disease condition. Now, what will this? What is the scientific rationale? This will enhance the patient's knowledge as regards the disease condition and psychological relaxation. Then number 3 is we encourage the patient to verbalize complaints, concerns, and worries. And this expression often relieves the tension and correct misconception. And lastly, what we do is we give diversional therapy such as watching of TV, and this is to allay the patient's anxiety and fears. And when I was dealing with this particular nursing diagnosis, which is anxiety, I didn't add giving of medication as one of the nursing intervention. I gave just 4 because this guy just have asthmatic episode, right? And most possibly the anxiety will not be much. Well, most patients are already used to it. So it's to just talk to them, answer their questions, and they'll be fine. You don't need to give sedative, but in severe cases, one of the medication that is given, they give sedative to calm the patient down, especially when the patient is preparing for surgery. Like prior to surgery, you have to actually give sedative most of the times. If the patient is very anxious, the patient is in pain and everything. So let's look at our evaluation if we're able to meet our goal. Now, our evaluation was that the patient verbalized less anxiety after 10 hours of nursing intervention. So it was the goal was achieved 10 hours after. So out of 24 hours, within 10 hours, at reached that time frame. It was after the 10 hours, we're able to get our goals done. And there's a consistency in what I showed you. When you are resolving nursing care plan, make sure that your evaluation is not, the timing in your evaluation is not above your objective. It should be lesser in that of your objective. So you're going to be resolving more nursing care plan.